Welcome to WakeGov TV. I'm Sarah Williamson-Baker from the Wake County Public Affairs Office. We have several topics lined up for you today. We'll be talking about the mental health care system and how behavioral health is changing in Wake County. We'll have many details on that. Plus, the beginning of the year is a time when many people go to a doctor for a physical. We'll have some advice on questions to ask and tips to make sure you're getting the most out of your time with your physician. But first, I'm joined by Dr. Brent Myers from Wake County EMS and Joe Durham, our Deputy County Manager, to talk about one of the Commissioner's goals from 2012, which is improving efficiencies and effectiveness for EMS and the fire system. Thank you all for being with us.
Thank you. It's good being here.
Glad to be here.
Mr. Durham, let's start with you and talk about the Commissioners. They recently hosted the Bayleaf groundbreaking at the fire station. Tell us the importance of this project as it relates to our residents and improving efficiencies.
That was a great event for Bayleaf and also a better event, I think, for Wake County as a whole. The fire station there was originally built in the 80s, and it was built when we had a different system, realizing or relying more so on volunteers. Now, of course, 30 years later, it's much more of a professional organization. The old building was small. The new building that will be renovated will be multi-story, two-story facility with about 16,000 square feet. And I think it's indicative of us wanting to do a better job in terms of responding to calls in the area, doing a better job, of course, of being more efficient and effective in that area. So I think it's a great event for Wake County and Bayleaf.
And looking at EMS, there's been some changes in the last year or so to improve efficiencies through your system as well. Can you tell us about those?
Sure. I think the first thing that's important for the citizens is it is transparent to the citizen when you call 911 what agency may respond or what first response agency may respond. The number one outcome that we measure is patient outcome. How does the patient do after they call us? So with that in mind, we then design the system to look at other efficiencies and effectiveness as long as the patient outcomes don't change. So with that underpinning, some things have changed in the system. The first has been the revenue model. Under the old system, each agency collected their own revenue, and then we offset that against a list of charges. Where we are today is that all the revenue comes into a central area, and we then can budget each agency in a similar manner. And that allows us to have much more oversight, much more control, and also prevents there from being some of the issues that we've experienced in the past with agencies that were not exactly the best stewards of the taxpayer dollars, accountability and things such as that have closed some other agencies. We now have kind of taken that off the table. So the centralized revenue model is helpful in that regard. The last thing I want to say about the way the system has been redesigned is that we have now a fourfold way that we look at quality. The first of those, as we've already mentioned, is patient outcome, and we've been looking at that. We now have a patient satisfaction external survey where we are monitoring not only how well we think we're doing, but how well the patients think we're doing. We're looking at the financial model and making sure that we're being good stewards of the taxpayer dollar. And then finally, we're looking at our own internal education to make sure that our providers have the best education and the best training in the country so that they can provide that best service to the citizen.
A moment ago, we were talking about Bayleaf, and over in that part of the county, Station 3 is going to be a co-located facility with EMS and fire. What is the benefit of that for our residents?
The notion that there needs to be a separate station for fire and EMS is sometimes true depending on the geographic location, but most often fire stations are well located in the community, and it makes sense for us from a capital perspective not to add an additional building, but rather to share one that exists. We have had that relationship actually with the Bayleaf Fire number 3 for a number of years, dating back to the Six Forks EMS days. But this is going to expand that relationship and allow us to have extra areas of storage for our units, for the EMS units, as the Bayleaf folks transition to their new station.
Mr. Durham, as we look at the fire system, the fire tax district has been getting a little bit smaller over the years. What is the impact of that and how we continue to provide quality services?
We live in an area, of course, that is experiencing tremendous growth. Our population now is about 940,000 people or so, and that has caused a decreasing amount of area that's served by the nonprofit fire departments. So we've had also a shrinking or a tax base that has not been increasing. But at the same time, over the last 10 years, we've had a doubling of our fire expenditures. So we've got to look at, as the same that's been done in emergency medical services, looking at mergers and consolidations. We believe that that will create some better efficiencies, because we do not have a sustainable model at this stage.
About a year and a half ago, we opened the new Garner co-located facility. What is the benefit to that community, particularly, of having those shared services?
I will speak first from the EMS side, and then we can touch on the fire side as well. But from the EMS perspective, there was an area in that district, which, as you know, is approaching the Johnston County line in the kind of the southeast corner there, that there was no way for an ambulance to arrive at the home in a reasonable period of time, just from geography's perspective. So this allowed us to enter into that area with a shared cost rather than with a unique cost for EMS. And I'm sure the same is true on the fire suppression side. That area that had no coverage now has coverage for both of these essential public safety elements with a shared cost rather than two individual costs to the community.
Is there anything else you'd like to add on that?
I just think it's important to, again, with our theme of providing more effective service, this does allow us to do that. By having that unit, that fire station there, allows us to have a better response for residents living in that area. So it has, I think, increased the effectiveness of fire service in that area.
Looking to the future, what is the next things that our residents would be seeing as far as efficiencies and improving service?
I think on the fire side, again, I want to reemphasize that we're still looking at those mergers and consolidations. I think also we want to be able, because it's first unit response right now, the closest unit response, is that we need to look at our fire service districts, our first responder districts, and try to get those lines merged. Again, looking at the consolidations as they present opportunities for us in the future. So those are the things that we'll be trying to focus on. And again, we want to make sure that we're not raising taxes in that area, that we're being as cost effective and efficient as we can.
And this month actually marks my 10th year with Wake County, so I can say that for the 10 years that I've been here, every year we reevaluate the cost structure of the current EMS system design versus additional mergers and consolidations. And each of the years that I've been here, those have come to fruition, in that we have looked at the cost structure and said it makes more sense today to have this agency merge with this one or that one with the other one, and we're continuing to look at that with that, again, that emphasis on quality. The other issue that is coming before us is that we kind of now have a roadmap for healthcare reform, and EMS revenue models are going to change. So with our advanced practice paramedic program, with our billing program, we are trying to optimize the revenue for our EMS to decrease the burden to the taxpayer to provide this service. So the way that we bill, the services that we provide, the destinations where patients go, they may not all go to emergency departments in the near future. We may facilitate you to a clinic or facilitate you to your doctor's office. Those changes are coming as well as part of healthcare reform.
Thank you so much for taking the time to be with us. We appreciate having both of you. We're going to take a short break, and when we come back, we'll be talking about the changes that are occurring in the behavioral health care system right here in Wake County.
Don't look at me. Your hair's a bit frizzy today. Oh, you should pick that up. Oh, you're such a dork. Loser. Here, let me help you with that. Oops.
Every day, kids witness bullying.
Oh, look. Your crush is looking at you. Poor you.
They want to help, but don't know how.
See, no one here's gonna help you, because no one
Teach your
likes you.
kids how to be more than a bystander. Visit stopbullying.gov.
I'm joined by Denise Foreman, who's an assistant to the county manager. She's here to talk about changes that have occurred in the behavioral health system. Welcome, Denise.
Thank you.
First, can you share with us why there's a need for changes and what some of those changes are?
In the last 10 years, the state of North Carolina has been working through mental health reform, and we have more recent versions of legislation that requires that we manage and provide our services differently across the state of North Carolina. The most recent change became effective on July 1st for us. We created a multi-county LME with Durham County, and the creation of that LME has presented a conflict of interest for us, so that we have to provide our services differently.
UNC Healthcare is part of this partnership, and what is their role?
We're so excited to have them at the table with us. We've actually been working with UNC Healthcare for several years, but last fall we entered a partnership with them and the state of North Carolina to have a study done to evaluate the programs and services in Wake County and determine some needs and gaps that existed and any potential opportunities for UNC Healthcare to come and help fill some of the needs and gaps. So we finished that study in the spring, which aligned with our formation of Alliance Behavioral Health Care. So they ended up partnering the study with us and helping us. A lot of these changes ended up all coming at the same time, which was pretty exciting, actually, a little scary, but exciting at the same time. We had the results of this study that identified some needs and gaps. We created Alliance Behavioral Health Care, and in the creation of Alliance Behavioral Health Care, we developed a conflict of interest for Wake County because Alliance is managing funds for services that are provided by Wake County, and we can't do that. It will be in conflict with Medicaid laws, and so we can't do that. So Wake County actually has to get out of the business of being a provider of services for behavioral health care. So we had the study, we have a willing partner in UNC Healthcare, and we had changes in law that require us to do the businesses that we do differently. So UNC has agreed to step up and help us out, and they're going to take on the services that we're currently providing at our Wakebrook campus, which include facility-based crisis. We do detox, rehabilitation services, and then UNC Healthcare is going to also step up and open 16 inpatient psychiatric beds to help fill a critical need in the community that's causing long wait times in our crisis and in our emergency departments. So they came to the table over a year ago, and it's taken a little time to evolve and figure out the appropriate role for them, but we're certainly excited that they're here.
For folks at home that are wondering how these changes affect them, what are some of the information that they might need to know?
A number of changes will be transparent. Citizens won't feel a thing, but others may, as we move through the evolution of the transition of services, others may become more apparent. We may have to move some services from a facility to another, as we find providers, and the providers are in different locations. So residents may find that they are seeking services in different locations, and others will be exactly as they appear now. They will just be provided by different providers, and so they may present themselves at one of our facilities and may be treated by someone different than they would have a year ago, but they largely will not know that. So most of the services that are being provided to our residents today will continue to be provided in the future, but they may be provided in different locations or by different staff, or they may be provided by the same folks in the same place. As we work through this transition over the course of the next 6 months or so, we'll find out more information how those transitions will occur. But right now we anticipate much of it will look largely the same.
How can residents find out more about the changes as they're occurring?
We've established a website, bhp.wakegov.com, and on this website we have provided a lot of information for residents, businesses, doctors, many folks to be able to find information to help them as the transitions continue. We've got studies and research that we have done, so we've got a section with documents that are great information of evaluations that have occurred. And then we have our ongoing evaluation of the programs and services with regular weekly updates as our group of stakeholders work through the evaluation of our programs, make recommendations for programs moving forward. And then as we develop our recommended plan and our approved plan, we'll include all of that on the website moving forward.
Well, thank you for being with us. Is there anything else that you'd like to add before we go?
Just to encourage folks to stay with the website. The website will be updated on a regular basis and will be the most accurate source of information for folks.
Thank you so much again for being here today. We appreciate your time.
Thank you.
Nice. Yes, go! Yes! No! Come on! Oops. Yeah, sure. Let's go.
Moms everywhere are finding ways to keep kids active and healthy.
Works every time.
Get ideas, get involved, get going at letsmove.gov.
Historic Oakview County Park is a unique site featuring a 19th century historic homestead with a mission to interpret North Carolina's agricultural heritage and rural history. The most recent addition to the property is a tenant house. The house arrived at Oakview in September 2012, and restoration projects are getting started.
Well, Historic Oakview County Park interprets the history of North Carolina agriculture. We do from about 1850 to 1950, so we cover a 100-year time span, and we do that through educational programs, through special events, through exhibits, but mostly through our original structures that are here on the property. What's always been missing from that story is a physical presence of all the sharecroppers and tenant farmers that lived here on the property that made that farm work. And that's what we hope to bring back now that we've been able to move this house onto the property, is to be able to tell a fuller story of all the people that lived and worked at Oakview and what they represent in North Carolina's history. It's always been part of our goals here at Oakview to find a tenant house or to reconstruct a tenant house, but it's a really large project that would take a lot of resources to pull off. So it was something we always kind of looked to do, but didn't think it would be something we actually would be able to do. Then about 3 years ago, we found this structure, and it existed on a piece of Wake County open space property. So it's something the county already purchased and was preserving as open space. So we went to look at it and saw what a tremendous match it was. We had some photographs of some of the houses that were here originally, and it matched so perfectly that we thought, all right, this is our chance to interpret tenancy at Oakview.
We actually went out to the structure 3 years ago for the very first time. It was perfect, other than the fact that it needed a lot of work. Termites have been very active in it. However, structurally, it matched perfectly what we were looking for. We had to remove several additions off the back and side of the house to get it to the form that you see right now. In September of this past year, we were actually able to finally move it here. What we're trying to accomplish here is show as accurately as we possibly can what a tenant house around the turn of the century here in North Carolina would look like. There's nothing really out there like that in a museum setting today.
We knew a lot about the people who owned the main house and learned more and more about them as we did more research. What we haven't known about are the other people. The people originally when the main house was built in 1855, the people prior to the Civil War who were enslaved here, and then after the Civil War, the people who lived here and worked as tenant farmers. Particularly people who were enslaved in North Carolina, the skills that they had were how to farm. But after the Civil War, they didn't have places to use those skills, so their paths were kind of narrow, and a lot of them became sharecroppers and tenant farmers, where you would have a house like the one we have here, and you would work the land of the people that owned the farm, and you were in an agreement with them to give them a share of your profits every year. We don't spend as much time talking about what people did in the 100 years after the Civil War and how they lived and the way the system was set up, and that's what we're hoping to really accomplish. Once the restoration process is over, then we'll probably enter a fundraising phase to interpret the structure. It's a 2-room house, and we're going to do an interior like it would have been in a tenant house at that time period around the turn of the century in one of the rooms, and in the other room we're going to put in an exhibit about tenancy in the South and North Carolina in particular, and here at Oakview specifically. What we hope to do once we get that done, we'll open it up to the public, and we'll start taking school children through there. Anywhere from 20 to 25,000 school children a year here at Oakview. They get a glimpse into what life was like around the turn of the 20th century on a mid-sized farm here in our state. And most of the children that come through here have never even been on a farm before. They don't know what all that would have entailed. And we do curriculum-based educational programs to help support the curriculum in the Wake County Public Schools. And what we hope to do here is tell a little bit of the story of the big house versus the small house, and what was life like just across the way for the owners and for the people that worked on the farm. And it's easy to tell kids that, and it's easy to show them a photograph and tell them about the history, but you don't make that same connection that you can when they can actually stand there and see it. And they can see how close these people live together, that a farm Oakview size was a community of people. It wasn't just a person that owned a big, pretty house and lived there with his family and the rest of the farm just ran. There were so many different people that made that possible, and all of their life stories are as relevant and important for us to remember as the people that owned the big house.
To donate, please mail a check to Oakview County Park, 4028 Carrier Drive in Raleigh, 27610. Be sure to note on the check that the donation is for the tenant house.
So, I'm kind of new here, but I've noticed a trend. My human does this funny thing where she goes around and gets all my toys, and then she hides them in that basket by the door. It's like, hello, that's where you put it last time. You were the worst at hide and go seek.
It's that time of year when people head to the physician to get a nasty cold checked out, or maybe get a flu shot, or perhaps even their annual well checkup. Dr. Peter Morris is Wake County's Human Services Medical Director. Thanks for joining us.
It's a pleasure.
When people think about going to the physician, there can sometimes be some hesitations about that annual well checkup. What are some of those about, and how can people kind of move past those?
I think the whole new move is to reframe medical care as health care. If we only go to the doctor when we're sick, we're only going to have our problems like colds, like flu, like gastroenteritis diagnosed. And if you're trying to be healthy, you need to know how to better promote your health. And the purpose of that annual visit to your primary care physician is to say, where am I today in my health, not where am I today in my illness.
So what are the questions that you should ask your physician to kind of figure out where you are in your overall health?
Yeah, most of the recommendations for preventive health care have to do with how old you are and what your family history might be and what sex you might be. So the questions really are, for someone of my age, what should I be thinking of? And listen carefully to the answer. Most doctors will make it sound like a medical term, and they'll say, well, for your age, we should be screening for cervical cancer, or for your age, we should be screening for colon cancer, or for your age, we should screen for breast cancer. Those three issues are actually a little more complicated than they once were. It was the annual pap smear, it was the every 5 or 10 years mammogram, and it was the every 10-year colonoscopy. But based on you and based on your family history, your testing interval may be longer apart or closer together. So it's asking for the recommendation and how the recommendation applies to you.
When we start thinking about the annual doctor's visit, there are some things particularly that men or women or children in different age groups might need to focus on. What are some of the overall general things that men should be paying attention to?
Sure. Well, one of the general things you can say is that we all should know our numbers, but it's not just knowing our numbers. So when that blood pressure is taken, when that pulse is taken, when your weight is calculated, it's knowing them and knowing what they might mean. We're learning more and more about the treatment and prevention of cardiovascular disease, of heart attacks and stroke. And your numbers, your blood pressure, your heart rate, your cholesterol, and your weight, all can affect a plan, not just a medication, but a plan that can actually keep you from ever getting sick in the first place. So everything that's done in the visit has a motive other than just filling in a check sheet. Ask whether that blood pressure is right for you. We're learning that we should treat lower levels of blood pressure more often with diet and salt restriction. Ask whether your weight is what it should be for someone of your size, someone of your height and of your frame. It's hard to maintain healthy weight. It's hard to lose weight. It's hard to gain weight depending on where you are, but there's no doubt that being in an optimal weight is a way to be at optimal health. So for men, ask those questions about blood pressure. Ask those questions about weight, because heart disease remains the #1 killer of men in this country. For women, heart disease is creeping up. Cancer is actually changing from breast cancer to being lung cancer. What are your risk factors? What are your lifestyle changes that might need to be made? Are you a smoker? Have you ever thought of quitting? Do you need help quitting? It turns out that people who say they're interested in quitting actually set a date for when they wish to quit, can succeed in quitting by that date. And there are therapies and there are medications that can help you do that.
A few moments ago, you mentioned losing weight or gaining weight. A lot of people at the end of the year and as the new year begins, particularly start thinking about losing that weight. What are some questions that you should ask your physician if that's an objective for you?
The nutritionist will hate me for this, but I'm not so certain the correct question is, can you give me a diet? I think the question is, what does a diet mean? People tend to say, well, I bet I need to be on a 1,200 calorie diet or a 1,500 calorie diet. Truth be told, if you take in too few calories in a day, your body's metabolism says, gosh, I need to go into starvation mode. And you'll actually be eating less and less, feeling less and less healthy, and not losing weight. There's an optimal caloric intake for your size. There's an optimal caloric intake for your weight goal. And you aim just below it or just above it, depending on whether your need is to gain weight or to lose weight. People don't think of gaining weight as being something that's healthy, but it is true that those of us who are underweight are at risk for disease as well.
The other part that goes into that for a lot of people is fitness. Are there questions that you should ask before beginning a fitness regimen?
Yes, the classic is to say, you know, can I engage in a fitness regimen? Again, just as we're apt to do a binge diet and say, I need to lose weight after this Christmas, we're apt to do a binge exercise routine and say, I used to be able to run 5 miles. I think I'll go out and run that 5 miles now. Again, truth be told, it's small amounts of caloric changes each day that help you lose weight, and it's small amounts of exercise each day that you can sustain that help you exercise and maintain fitness. For purposes of blood pressure and heart disease, walking for a half hour, 3 to 5 days a week, is as good as going out on the weekend and saying, I'll do a half marathon. It's that constant cardiovascular fitness and tone that prevents against disease.
Final question before we wrap up. There's always changes going on in the pediatric community. What are some of the latest tips that parents should be aware of?
I think what's the biggest issue these days is that folks are worried about the number of vaccines that we give to children. Parents should be confident that the vaccines that we give are safe, that they were effective, and they're given at certain ages for a reason. When parents say, I really don't want my child to have too many shots today, those shots weren't just picked randomly to be given at 6 months or 12 months or at 18 months. They're protecting against the illnesses that are more likely to occur at 6 months, 12 months, or 18 months. So accept that vaccine schedule on time if you want to keep your child well. The vaccines are also a great way to prevent what used to be common scourges, if you will, of disease. Since we started giving the pneumococcal vaccines, we have prevented ear infections. We've cut in half the number of infections a child has. So think vaccination as prevention.
Thank you, Dr. Morris. As always, great advice and great tips for our viewers. That's all for our show today. To keep up with the latest Wake County news and information, visit wakegov.com/news. You're also invited to follow us on Facebook and Twitter. Have a great day.